Well, hello, everyone. Welcome to this week's LinkedIn Live and the Sell Your Skill podcast, where I highlight an amazing healthcare entrepreneur every week. My name is Claudia Garcia. I'm your host. I'm also the CEO and founder of Royalty Medical Solutions, a search, staffing, and consulting firm. Today, I have a wonderful guest with me, Nurse Ava, and she is going to tell us all about her business, which is mentoring and coaching nurses who are working internationally. So, a little bit about Ava. I'm going to introduce you really quick, Ava. Tell everyone all the great things about you. So, she is an international nurse mentor with a passion for empowering healthcare professionals across the globe with extensive experience in clinical practice, leadership, and education. She has guided countless nurses in advancing their skills, adapting to diverse healthcare systems, and enhancing patient care. As a mentor, she specializes in professional development, cultural competency, and evidence based practice, thus helping the international nurses globally through one on one coaching and online resources. She is also committed to lifelong learning and continues to inspire the next generation of nurses. So, Ava, I'm excited to have you on here. I think we met on YouTube, right? Or did we meet?
Yes.
Okay. So it's funny because most of my connections, I either meet them on LinkedIn or YouTube.
Yes. Thank you so much for having me.
Yeah, so I stumbled upon your YouTube channel, you stumbled upon mine, and we just started to exchange some notes and chatting. And so I am so excited to have you on this week's live. So let's start from the beginning.
Yes.
What called you into nursing? And then you had to have become an international nurse to become the expert in international nursing. So what prompted you to then start mentoring?
So I started nursing way back from Jamaica. So I'm an international nurse. And I was prompted into nursing growing up with my mom, who I saw caring for other family members. So I said, this is something that I wanted to go into too. Did to Jamaica, worked with the government, did community development, networking, professional development, and then I decided that I wanted to just enhance my career some more. So I decided to do international nursing. I took that risk, and here I am today.
Yay!
While doing that, I realized that there was a need for more. I experienced lots of challenges in which that I didn't know where to get resources from. I didn't know who to go and ask because I'm like one person from my country leaving, coming to the United States.
Yeah.
It wasn't much persons to ask. And eventually, when I transitioned, I was the only or the first international nurse on my unit. And that
Wow.
was quite overwhelming for me. Then other nurses started to come in. They even asked me, how did I do it? So while being there, they even started calling me their big sister.
Mhm.
And because I started sharing information, teaching them how to do stuff clinically, if they
Uh-huh.
weren't at work or if a memo was put out or a policy was submitted today, I would send them a memo and say, hey guys, this came out. Please be aware of this. Other persons started to see me and started reaching out to me from Jamaica, which I'm from. And then
Yeah.
I decided I think there's a need for this and I need to start sharing my story. And that's where I went online, started telling everyone how to become an international nurse, started sharing regulations globally. And I shared a regulation which Canada made just to make international nurses have it more easier to come to Canada. And that became viral. And I was
Ooh.
shocked. A lot of nurses reached out to me from across the globe saying, how can we do this? Where can we go? And I was like, okay, this is something that is needed. And today I can't even count how many nurses that I've actually worked with and assisted right across the globe.
That's awesome. So you identified a gap immediately. First of
Yeah.
all, you were one who came, so you were a trailblazer. You're one of the first, and at least you were one of the first there in your facility.
Mhm.
And so now you're feeling this gap. I did see that video about Canada. So that's really cool. I mean, for those of us who are not travel nurses or international nurses, I should say, what exactly is the opportunity in Canada?
So the opportunities in Canada are very vast. They have programs, and it's similar to the United States where you have to go by the provinces and apply through their board of nursing. They also do the NCLEX also, and they have a great need for nurses to be there. So they're always having programs for nurses to come. However, there was a breakdown in the amount of information of how nurses could go there. International nurses also suffered quite a lot in that they have a lot of backlogs in registering, waiting, transitioning, and just trying to get a job, and it was so hard. So the Board of Nursing decided, and I think it was specific provinces that decided that, hey, we're going to decrease the wait time and we're going to give specific countries like opportunities, like ease of access to come. And I listed all those countries online, and it was surprising that many persons did not know that that existed. So that change in regulation really opened up some more opportunities for nurses to have ease of access to go to Canada.
Wow, that's so great. So it sounds like they're doing something right because
Yeah.
to have a backlog when you have such a great need, right? It's wild to even think
Yeah.
that they would make it so difficult, right? So
Yeah.
I have a question. So here in the U.S., are you're practicing in the U.S. right now, or are you in Canada?
I'm in the United States.
Okay. Are you seeing any major changes with some of the new regulations, or is there any pause in the nurses coming over right now?
So in terms of regulations, I think the US has a pretty good pathway for nurses. I've always preached about that very quick pathway. To even the other day, a couple months ago, a researcher reached out to me trying to do research for Canada to see what they can do, and I was sharing some steps with them. But right now, for the United States, the biggest thing that everybody's talking about now is visa retrogression, where they're having a pause, clearing up backlogs in terms of how many nurses get access to those EB3 visas or green card to come to the United States. This is a major issue because many nurses are waiting in their home countries. Some of them, they have dates that they're waiting on. And I think they're 3 years back right now. And I think 2025 is the year they're saying that they may clear this up. So I do have a lot of nurses reaching out to me saying, should we still consider this? Or what should we do? So this is where I post content on my YouTube pages, follow the government websites, and educate them that, hey, this is the update that we're doing and what you need to do in your home country while you wait. This causes a lot of issues for the US also because they're waiting for nurses. I did see a couple managers from my facility saying that, hey, we're waiting on them to come. We did interviews, but we just do not know when. So it has been quite a pause, but this does happen quite sometime. I faced it too, and I'm now here in the US. So it requires resilience and waiting on our nurses until that process is cleared.
Okay. So it's not impossible, and we definitely should not give up on the process of
No.
bringing international nurses to our hospitals here in the US. So hopefully things will get better sooner than later,
Yeah.
and we'll start to see things open back up if there is a pause or anything like that.
Mhm.
So what's exciting about what you're doing is that I believe that everyone needs a mentor. And
Yes.
so you have given back to the nurse. So we say, like, you should mentor somebody that, who you used to be, right? So if
Yes.
you were once, a lonely international nurse without direction, then you should also be sharing what you've learned and helping those along the way. So you're doing it. So I want to ask you, how are nurses getting a hold of you? Are they just finding you on your YouTube channel? Because your YouTube channel is getting some traction. So are
Yes.
they finding you there and then just emailing you?
So they find me on YouTube, they find me on LinkedIn. I'm on all social media and also TikTok. That's where everybody is right now.
Okay.
So everybody reaches out to me right there, and then we coordinate with emails, do links with Zoom, and we meet up. People also ask questions quite a lot. The other day, one nurse reached out to me asking, hey, I don't think I should continue with this process. What advice would you give to me? And that's where they reach me, and that's how I provide educational information. And also on YouTube too, we do a lot of educational information.
That's good. I like that you're taking the mystery out of how someone becomes an international nurse. And also, you're highlighting the opportunities of where they can go. So it's not just about the US, you're highlighting other countries, correct? So you just shared
Right.
about Canada. Are there other countries that are currently really big on bringing in international nurses?
I think quite a number of our first world countries, the UK has a program also, Dubai, Australia, that's a big thing right now, and New Zealand. They have quite a number of pathways offering, and they're making a lot of changes when I'm watching the news with regards to that. So it's quite diverse, even Germany, Ireland, all across the world.
Wow, wow, that's so neat. That's so neat. So where are these nurses coming from?
All across the world. I have individuals reaching out to me from India, spoke with a nurse from India, Dubai, spoke with nurses from Philippines, Zimbabwe, in the Caribbean, nurses from the US also, spoke with a nurse who was interested to go to Australia, to Canada, all over.
Okay, so US nurses who are also looking to go to Australia, anywhere, Germany, the UK,
Mhm.
you can also help those nurses.
Yes,
So this is not just about others coming here, but oops, I'm hitting the mic, fighting with the mic. Others coming here, but also us sending our nurses out. So that
yes,
is so cool. Now, YouTube is such a great platform. And last week I had a young lady who is very successful on YouTube. And then the week before that, I just happened to have a physician assistant who also started a YouTube channel and just blew up. So
right.
tell me, what are the benefits of showing up on YouTube as a nurse mentor? Is this where the nurses are searching for help?
The benefits for YouTube, I think they are vast. And I think this is where the nurses are searching for help. You know, we have the new generations, the Gen Zs, the millennials, and this is where they are. And I think YouTube is a great tool to advertise your skills and to allow people to see you, because you're searching everyday nurses. I do search online too as a nurse when I need information, anything educational, anything that's trending in the news, because I even call it YouTube University
Sure,
because
yeah.
that's where everybody is. And I think it's a great opportunity for nurses, especially, to put themselves out there, because you never know who you're impacting. I just started to do YouTube and I was in the US, and I realized that my video is reaching everybody, particularly everybody across the world. So that's an impact right there.
Yeah. That is so neat. It's neat that you can sit in your home, in the US and then reach the world. It's just the
Yes.
coolest thing ever. And everyone should really take advantage of it if you
I,
have a
yes.
global product. And in your case, your product is something that can serve globally, right? Serve others globally.
Yes.
So, my next question is, do you have any success stories of nurses that you've worked with that you've heard from them recently and they're just loving where they're at, or an assignment that they've taken?
Yes, I have quite a lot of success stories because we do also offer help with nurses who take the NCLEX, provide support, because I took that too. So quite a number of them reached out to me and say, "Hey, I did the NCLEX and I passed." And that is a great, great success achievement for me. And not only that too, I remember working with a nurse who told me that she tried every single program and she just got countless denials. And I
Mhm.
decided just to take her under my wings. And I said, "What are you writing on the paper, or what are you saying in the interview?" And, I met with her, revamped her resume. And then 2 weeks after that, she called me telling me that she got accepted into the program.
Oh, that's amazing. And that must feel really good.
Yes, it
Yeah,
does.
yeah. That's one of the reasons why I chose to add staffing to my business about 7 years ago, was
Mhm.
that I loved giving people a new opportunity. And usually careers and those type of opportunities are life changing. So
Yes,
imagine the impact that you can have on somebody when you help them transition into a new job, or even into a new business as you mentor them.
yes.
So, if you were going to start today as an international nurse, so you were in Jamaica and you were going to start today, what would you do first?
The first thing I will do is research. I've always preached that: research, research a country that you want to go, look at the cost of living, and know your why. Very important to know your why. Do not just leave your country because other your co-workers, your friends are leaving, or even if you just have family there, make sure you know your why, because it does get tough, it does get hard, it gets challenging when you reach that. There's a phase that they say you go through. You're excited when you get there, the honeymoon phase, then the dust settles, you miss your home, your country. Things may happen. You need to know why you're leaving and the purpose that you're doing it for, and that keeps you going. And always remember that when you do something like that, you're taking a risk, and you have everything before you. You have trained as a nurse. So no matter what, you're going to succeed.
That's good. That's good. So if they can focus on being confident in what
Yes.
they know, when they come here, it's going to be easier. So if they can just remember that they're already equipped to do the job. Now
Yes.
it's just about getting settled in a new place. I mean, I moved, between states. I moved from California. I'm born and raised in California. I moved to Texas, and it was the same thing. Honeymoon, first
Mhm.
year, and then year two was like, oh crap, I have like no family, no community, no friends. Yeah. So and then I had to start over. And at my age, well, I wasn't too like excited about starting over. So tell me about what you're doing with the nurses, and you've created a community. So
Mhm.
how are the nurses helping one another, and are you able to get them together to support each other?
Yes, so we help one another and support each other through our online community. So we share resources, we share updates, and that's how we work together. We have nurses all across the US. So I do have nurses who are in a particular state. If a nurse reaches out to me and say, hey, this is a state I want to go to, I call those nurses and ask, what are the best hospital systems? Where can they go to and thrive? What are the communities and the school resources that you have in that area? And that's the community that we have and work together. Any regulations or policies that are passed, even if we're already in the United States, passed through international nursing, we share that
Mm.
with other nurses that are waiting to do that process also.
Okay, that is so great. I think that's so important because I think that's going to be the difference between somebody being real homesick, is
Right.
they can find community, especially within the same maybe county or city that they end up in. I know with us when we deploy nurses, I mean locally, we connect all the agency nurses so that they have community at their
Yes.
assignment. So I think it really does help them. So, where is this community? Do you host it on Facebook, on LinkedIn? Where is the community hosted?
We host a community on Facebook also, and we also have a community on YouTube. And right now, we're in the process of generating like a newsletter just to get everybody more cohesive. So those are where our communities are, and also on Telegram too.
Oh, that's so great. Okay. I'm assuming that is that how you communicate with them and answer questions is through Telegram?
Right.
Okay.
Yes.
Okay. So you're just a phone call away. That's really cool.
Yes.
Oh, well, that's great because I think that's what people want nowadays. It's like you have a quick question and I just need this question. What do I do next? This question answered. What do I do next? And so you've made yourself available, and so I applaud you for doing so much to serve this community. I think that's awesome, and I'm sure that it is going to continue to grow
Yeah.
in massive ways. And so what are the next steps for you as a nurse coach or mentor?
So the next steps for me includes that we're working on planning a workshop that will be centered around skills training for international nurses. We're going to be doing that virtually, and hopefully then we can transition physically to a country. With the impact now of retrogression, a lot of nurses on pause. It's very important that they work on their skills. So this program will be helping them to get acclimated to the US system in terms of equipment, documentation, and I think this is something that they'll actually learn from. And not to mention looking at a program that we can develop to assist some hospitals in terms of retention of our international nurses
Mm.
after they've completed their contract. And that's another big thing. So that's what we're working on right now.
Yeah, you just brought up a great point. So, what happens when the nurse completes their contract? And usually, these contracts are they 2, 3 years? How long?
Majority of them last for at least 2 to 3 years max.
Okay. And so then after the 3 years, are they then do they have to reapply for the visa? Do they start the process over? Or are they now green card holders and they can stay and take a job anywhere?
So once they enter the US, within 90 days, they receive their green cards through the mail,
Okay.
and their contract lasts for about 2 to 3 years, depending on the company or the hospital system that they choose to go through. Once the contract is ended, you're free to go on your own and work or live anywhere in the United States. So you don't need to renew anything because your contract has ended.
Okay. And so, what about challenges? Are there any challenges when it comes to these contracts? Have nurses landed in maybe a place that they didn't love? And if so, what happens?
Yes, they have faced numerous challenges. Some of them may not have done proper research. And if you live outside of a system, once you get inside, you see a lot of new things pop up. So a lot of nurses have faced challenges in terms of being in an area where they don't feel that they're getting much support, or the work environment is not really working out for them. Could be financial, could be a whole lot of things. And we do provide assistance in, educating them how they can maneuver to speak out. A lot of nurses are in fear sometimes because they're in a contract to speak out about the issues that they're facing in the event they get retaliation. And that's where we say, listen, you have to speak out in order to get support, and you cannot suffer in silence. And that's a big thing that we encourage our nurses not to do.
Oh, wow. That's really good. Yeah. So I guess it's important to share what some of the challenges might be as well as the
Yes.
perks and the good things, right? So that there's less surprises and perhaps better prepared for where they're
Right.
going to end up. So if a nurse does want to break a contract, what happens?
If the nurse decides to break a contract, it goes back to what was laid down in that contract with that agency or the hospital. Normally, hospitals, for the agencies, I know they have a bond where they have to pay back a fee. They normally have a fee. I've seen like $40,000 or $50,000 fee. I'm not sure if there's a payment plan arranged. And I encourage my nurses at all times, make sure you ask about conditions before you sign a contract. Educate yourself. If you see things in there that you don't understand, you can reach out to us and say, hey, what does this mean? Have a good relationship with your recruiter. You're supposed to ask questions, and they're there for reference also. If you're not comfortable signing something, do not sign it. This is a marriage that I always tell them. It's between you and also the agency. And then you're going to be tied to this agency or hospital system for that period of time. And it's
Wow.
supposed to be mutual benefiting because it's a contract.
Yeah, that's huge. And it's probably a little scary to think, well, I'm going to take this contract in a different country,
Hmm.
not 100% sure what will happen.
Right.
And now I'm on the hook for, a bond or whatever the rate or fee might be.
Yes.
So, all right. So that's a challenge they should think about. But there are probably a ton of perks, right? What would you
Mhm.
say are like the top, maybe top two or three perks of being an international nurse?
Oh, some perks I think of being an international nurse, it prepares you for a global stage.
Mm.
You're advancing, participating in advancing healthcare, and I'm always preach to my international nurses is that you're at an advantage to leave your home country, having understanding of one system, going into another system and gaining an advantage. There are so many things that you can gain and even give back to your home country. You can even become a consultant, do mentorship like I'm doing, and
Yeah.
not only that, it pushes you, it allows you, based on the country that you're going, the US, the opportunities are vast to grow career professionally and academically. And those are some perks that I think of being an international nurse. So once anybody tells me that, hey, I'm contemplating, should I do this? I always say, go for it.
Oh yeah. Yeah. Yeah, that's massive to open up all of these opportunities here. I know for them here in the U.S. So there's just so
Mhm.
much that they can do, and I'm sure there's massive opportunity in other countries.
Yes.
And so we've seen you. Your career has evolved, and so how long have you been a nurse?
I think I've been a nurse for over 8 years now, going on 10. I think I probably stopped counting.
Wow, wow, that's awesome. Congrats to you. A decade
Thank
of nursing.
you.
That's really cool. And what specialty, may I ask?
I have done so many specialties. I'm the type of person who likes to go learn and move on. I
Okay.
have worked in, I think I've done all specialties already. So medical step down, progressive care, home health, corrections,
Wow.
med surge, rehab, and I think that's it.
Okay.
I
Well,
can't
that's
remember
cool.
some.
Hey, that means you're a well-rounded nurse that can
Yes,
give advice to the nurses who are saying, "Hey, what's it like in the progressive unit? What's it like
yes,
in this unit? Or what's it like in this, type of facility?" So it sounds like you are equipped to
yes,
mentor and help these nurses. So kudos to you. Thank you so much for sharing all about your business and your YouTube channel. I'm going to drop your YouTube channel on the comments below. And
yes.
so all those who do to, who watch later, because there's a lot of folks that will watch the recording, they'll have
Mhm.
access to your channel and to some of your social media platforms.
Right.
So we are excited to continue to watch you and all of the great things that you're doing. And thank you so much for just spending time with me today.
Thank you so much for having me, Claudia. Thank you so much for all the work that you do too. I appreciate it, outfits.
Thank you. It's a joy. It's a joy to highlight amazing female entrepreneurs, especially in healthcare. So
Yes.
we'll have a wonderful week, and thank you again. Thank you everyone for
Thank
watching. Bye
you.
bye.